Hey, my name is Drew. I'm going to be your student nurse today. Now I'm just going to wash my hands and put my gloves on. It's 9 o'clock, so it's time for us to give you your daily meds. Can I have you state your name and date of birth for me?
Janet Price, 9/26/67.
Okay, and do you have any allergies that you're aware of?
I do not.
Okay, so I have confirmed her name, date of birth, and allergies in the MAR, and I've also confirmed all of her medications in the MAR. I did my 3 checks, and I also followed the 6 rights of medication. So to get started, I'm going to give you your oral meds. Your oral meds are going to consist of Ativan, lactulose, digoxin, metoprolol, and a multivitamin. So first I'm going to give you your lactulose. It is a 10-gram tablet twice a day for your chronic constipation. When was the last time you've had a bowel movement?
3 days ago.
Okay, so I've done an abdominal assessment on her. Nothing was abnormal. So I'm going to give her the medication because she hasn't had a bowel movement in 3 days. So this is, once again, a 10-gram tablet that your doctor has ordered twice a day. The normal dosing range is 10 to 20 grams once a day. And with this, you might experience belching or diarrhea. And I'm going to closely be watching you for abdominal distension and severe diarrhea, which can lead to electrolyte imbalances. So here's your 10-gram lactulose for chronic constipation. Okay? Next, I'm going to give you your Ativan, which is for anxiety. It is a 2 milligram pill every 8 hours. The normal dosage range is 1 to 3 milligrams, 2 to 3 times a day. And with this, it can cause drowsiness, dizziness, and it can also cause bradycardia, which is a slow heart rate. So I'm going to be watching mainly your vital signs, your heart rate, blood pressure, respiratory rate, and I'm also going to keep an eye out on your mental status to note any changes in your behavior, mood, or your level of consciousness. So here is your 2 milligram Ativan for your anxiety. Okay. Next, we have your metoprolol, which is for hypertension. So I've checked the patient's blood pressure. It was 170 over 98, which is a high blood pressure, so she needs her blood pressure medication today. And this is metoprolol ordered in a 50 milligram by your doctor tablet. The regular dosage is 25 to 100 milligrams once a day. This is 50 milligrams once a day. With this, you can have hypotension, which is a low blood pressure. You can also have pulmonary edema and swelling. I'm going to be closely monitoring your blood pressure, heart rate to make sure that they do not drop too low from the medicine. And I'm also going to be monitoring your daily weights to make sure you're not retaining a bunch of fluid. And I'm going to auscultate your lung sounds to make sure that you're not having any crackles in your lungs from pulmonary edema. So this is your metoprolol, 50 milligrams for high blood pressure. Okay, next we have your digoxin. This is for chronic heart failure. And what it does, it just decreases the workload on your heart. This is ordered in 0.125 milligrams once a day. The normal dosage range is 0.125 milligrams to 0.5 milligrams once a day. With this, you can experience arrhythmias and nausea, and I'm going to closely be monitoring your ECGs for changes in your heart rate, for changes in your heart rhythm, make sure it stays in sinus rhythm. I'm also going to monitor your daily weights, and I'm going to assess your blood pressure and heart rate. So here's your digoxin, 50 milligram, 0.25 milligrams, sorry, once a day for heart failure. Okay, now we have your last pill by mouth, and it is a multivitamin that your doctor has ordered, and it's just to help you keep up with your vitamins and your minerals while you're here in the hospital. So this is 1 tablet once a day by mouth. The normal dosage range is 1 tablet once a day. All right. And with oral meds, you always want to make sure that your patient takes the medications before you leave the room. You don't want to just leave them in here for them to take on their own. So now we're going to get started with subcutaneous medications. come here. And I'm gonna show the sites that we can give subcutaneous medications. So we can give subcutaneous medications in the back of the arm. We can give them in the abdomen, the lower part of the abdomen, or we can give them in the thigh. Where would you like your subcutaneous medication?
No.
Okay. So with subcutaneous medication, you're gonna pinch the skin and you're gonna go in at 45 to 90 degrees. I have the as needed order for insulin. I have checked her blood sugar. It was 215. So I'll plug that into the blood sugar formula. 215 minus 100 divided by 20 gives me 6 units. So there's not really a normal dosage for insulin. It just kind of depends on what the patient's blood sugar is. But in her case, we're going to give her 6 units because the doctor said as needed. So she said the upper arm with insulin, you can have, it's for your high blood sugar, so it's going to help your blood sugar drop down some. But it can cause hypoglycemia, which is too low of a blood sugar. And it can also cause swelling, like in the injection site, it can cause the tissue to get aggravated. So I'm going to watch out for swelling, and I'm also going to monitor you for hypoglycemia. And some signs of that would be cold sweats, tingling in the face, hands, feet, and it'll also likely cause confusion. So if you're having any of those symptoms after I give you this medication, I want you to let me know. And I'm also going to watch for hyperglycemia, which is just high blood sugar, because I want to make sure that her blood sugar is going down instead of staying the same. And since this is rapid acting insulin, I'm going to have to give you food right after I give you this medication. So I'm about to get started with giving you the medication. So now I'm just going to get this alcohol wipe and wipe the top of this vial. And I'm going to take the cap off the insulin syringe. And I'm going to draw back 6 units of insulin, some air, and I'm going to inject the air into the vial, and I'm going to flip the vial upside down and draw back 6 units of insulin. Okay. Come a little bit closer. And now I'm going to prep the site that I'm going to give the injection in by wiping it with an alcohol pad. And I'm just going to grab it like this, the skin. And I'm going to go in at a 90-degree angle because this is a very small needle. So I go in at a 90-degree angle. I release that and I pull the needle back. And I put this in the sharps container, not just the regular garbage can. I wouldn't recap the needle, but I'm gonna do it for now. So that was your insulin medication. It's gonna help lower your blood sugar and bring it down to a normal level, hopefully, and we're just gonna keep a close eye on that. So now it's time for an intramuscular medication. This is a medication that goes into the muscle of your body and it absorbs really fast because it goes straight into the muscle and it's closer to blood vessels. So with the intramuscular medication, you can give it in the upper arm, which is the deltoid. You can give it in the thigh area, which is in the ventrogluteal site, or you can give it in the upper thigh, which is the vastus lateralis. Which site would you like your shot to be given?
Upper thigh.
Okay. So with an intramuscular medication, you're going to go in at a 72 to 90 degree angle straight into the muscle. This medication that we have a PRN order for is Dilaudid. Can I ask you what your pain level is today on a scale from 0 to 10, 0 being none, 10 being the worst you've ever experienced?
An 8.
Okay, so the patient says her pain level is at an 8, so she needs her Dilaudid. So I'm going to give it to her, and I'm going to ask, have you ever had any opioid addiction, substance abuse, or misuse?
No.
Okay. So now that I have told her what medication she's given, I can tell her the dosage range. The dosage range for this is, your doctor has ordered 1 milligram every 2 hours as needed for pain. The normal dosage range is 1.5 milligrams every 2 to 3 hours as needed. So now I'm just going to swab the top of the vial. And I did my conversions and it came out to be 1 milliliter of Dilaudid per every 1 milligram. So I've drawn up the 1 milliliter of air and I'm injecting it into the vial. Now I'm turning it upside down, making sure the needle stays below the fluid. And I'm going to draw back 1 milliliter of Dilaudid. I'm going to thump the bubbles to the top. Alright, so since this is a pain medication, it can cause respiratory depression, a fall in your blood pressure, and it can also cause your heart rate to decrease, and it can cause some sedation type effects. So before I give this medication, I'm going to check the patient's vital signs. Her heart rate was 70, her blood pressure was 122/83, and her respiratory rate was 16, which is good. You do not want to give a pain medication if the patient has a low respiratory rate because it can bring it down even further. So I'm just going to be closely monitoring after this your respiratory rate and your heart rate, EKG, and blood pressure. And of course, I'm also going to be asking you about your pain throughout the time to make sure that you're getting better. So to do this injection, I'll find the greater trochanter in the hip and the patella, and I go midways in between, and it's this third of her thigh where the vastus lateralis is located. And I will clean the area now that I have marked where I'm going to do it. And I'll do the Z-track method, which is just where I get my hand and I pull that subcutaneous tissue back and I go in at a 90-degree angle, dart it in, and I push the medication in and then release my hand like that. And the Z-track method, what it does is it moves the subcutaneous tissue over and it lets the needle go straight into the muscle without leaking back into the subcutaneous layer and causing irritation and swelling and all that stuff that you don't want. Okay, so I wouldn't do this in real life, but I'm gonna do it here. Okay, so now that I've given you your Dilaudid for pain, I've given you your insulin, I've given you all your oral meds, are you feeling okay? Do you feel extremely different in any way? Okay, so now I'm not going to give you these medications, but I'm just going to go over suppositories, eye medications, ear medications, nasal drops, buccal medications, and sublingual medications. So let's just say I was giving a patient a suppository. I would lay them on their left side. I would also put on gloves, of course, and I would lubricate the suppository. And as the patient's laying on their left side, I would put the suppository in the rectum past the internal sphincter, and I would ask them to hold that suppository for 20 to 30 minutes. So the suppository has been given, we're done with that. Now I'll move on to the optic medications. So come here. I'll instruct the patient to tilt her head back, and I'm gonna have you stare at a point on the ceiling, and I would just lower this lower conjunctival sac, and I would drop the medication in there without touching the actual eyelid with the dropper. And then I would instruct the patient to close her eye, and I would hold some pressure right there on the lower conjunctival sac to make sure that the medication doesn't go over into the tear duct. And I would also instruct the patient to not rub her eyes or blink excessively. And she would hold her eyes closed for 1 to 5 minutes. Okay, so that's eye medications. Now we will talk about giving you ear medications. So what I would have the patient do, you can give it to them sitting or lying down, but I would prefer to do it lying down. So we would pretend that she is lying down, and for adults you pull up and out on the upper part of the ear. And of course she's going to be laying on the side opposite of the ear that I'm putting the medication in. So I would pull it up and out, and I would check first for any impaction or anything blocking the ear canal, because the medication wouldn't be able to get there if there was something blocking the ear canal. So anyway, I would pull up and I would not touch the dropper on her ear, and I would drop the medication in her ear, and I would hold pressure right there to make sure that it goes into her ear, and I would let her lie down on that to make sure the medicine goes into her ear for 5 minutes. And if I had to give another medication in the other ear, I would wait the 5 full minutes before I flipped her over and gave her the other medication. So we have done suppository, eye, and ear medications. Now we are going to go to nasal medications. So these are usually like nasal mist sprays that we give. So what I would have the patient do is I would ask her to tilt her head slightly back, not too far though, and I would first have the patient blow her nose if she needed to before I give her the medication to make sure it goes in her nose. And I would hold, say I was giving it in this left nostril, I would hold this nostril down, and I would instruct the patient to breathe in, and as she breathes in, I would squirt the medication into her nose, and then I would ask her to not blow her nose, of course, for 5 to 10 minutes. And if she required spray in the other nostril, I would just do the same thing, hold the nostril, instruct her to breathe in, and press down the spray into her nose. So the most important thing there is to not let your patient blow their nose 5 to 10 minutes, because they can just blow that medication right back out of their nose. Okay, so now we're going to talk about sublingual and buccal medications. These are in the mouth. So can I have you open your mouth for me? Come here. If I was giving a buccal medication, I would pull her cheek out and give it in between the tooth and the gum over here. And I would instruct her to not eat or drink anything while that is in her mouth. And if it's a tablet, I would not let her chew or swallow the tablet whole. And for sublingual medication, I would, open your mouth please, I would ask the patient to hold her tongue up. I would stick it into the sublingual pocket right there. And I would of course tell her to not swallow, not chew, not drink any fluids, or not eat any foods while the medication is in her mouth. All right, and just a general assessment, are you feeling fine from all your medications?
Fine.
Okay, and we're done.
Thank